Hi there, my name is John Goodall, and today I'm going to be walking through cognitive behavioral therapy, working with young people with depression. This PowerPoint is going to highlight how cognitive behavioral therapy, or CBT, is utilized when working with young people. In relation to working with young people with depression, this is focused more on young people whom are aged between 12 and 17 years old and who are presenting with mild to moderate forms of depression. So firstly, depression in young people. Taylor and Montgomery explain that around 30 to 40% of young people will go through an episode of major depressive disorder, with the biggest risk factors being genetics and exposure to psychological stress, like abuse, bereavement, and parental divorce. Depression in adolescents can be caused by a multitude of factors. To name a few, these can include things like substance abuse, parental divorce, death, genetical issues, abuse, school status, feelings of inadequacy, along with drastic events that have happened in the child's life. Burma explains that depression in young people does affect a crucial developmental period, which can increase long-term negative outcomes, such as issues maintaining and developing good relationships, poor physical health, and poor vocational attainment and achievement. This can also lead to an increased risk of self-harm and suicide. In Australia, approximately 20% of young people are suffering from high or very high psychological distress levels at any one time. Symptoms for depression in young people can include things like the young person having a heightened level of sadness or hopelessness. Young people may turn to alcohol and other drugs or substance abuse. They may have levels of low self-esteem, a lack in desire to do enjoyable activities that they used to gain pleasure from, such as hobbies, activities, and sports. They become less active, known as sluggishness. They begin isolating themselves from friends and family, having sleeping issues, appetite problems, along with headaches. Issues within school, such as failing, not paying attention within class, and getting into trouble more. They will also stop caring about how they look, and misbehavior will occur, such as running away from the parental home. So what is cognitive behavioral therapy? CBT is a goal-oriented and short-term form of counseling, which essentially is a combination of psychotherapy and behavioral therapy. The psychotherapy looks at the thought patterns, whereas the behavioral therapy discusses the relationship between thoughts, behaviors, and feelings. Essentially, CBT can be seen as a term for multiple forms of therapy that look at fixing maladaptive behaviors and dysfunctional cognitions. Therefore, CBT looks to reduce the presence of negative emotions. Goodall explains that young people tend to develop inaccurate beliefs about themselves, and CBT looks to confront and then modify these. A young person who thinks that they are unworthy will tend to find evidence that supports this view. An example of this could be that if they did bad on a singular test, that young person may assume it is because they are stupid. Or if there was a friend who did not call them back, they may think that that friend no longer likes them. CBT also is an educational form of therapy. The client takes an active role, including completing homework assignments given by the therapist. There are multiple strategies that are utilized, including Socratic questioning, role-playing, imagery, behavioral experiments, and guided discovery, and CBT tends to also be time-limited. So how depression and cognitive behavioral therapy interact? So CBT techniques focus on how particular thoughts or cognitions influence behavior and emotions. Therefore, CBT practitioners believe that if negative thought patterns are adjusted, depression can be also, along with other psychological problems. The overall goal of CBT is to help a person learn to recognize negative thought patterns, look into how this is potentially helping or hindering this person, and then replace them with healthier ways of thinking. When using CBT, The therapist aims to help change patterns of behavior that stem from dysfunctional thinking. Negative thoughts and behavior contribute towards depression for individuals. Therefore, when patterns of thoughts and behaviors are changed, along with mood. CBT focuses on two main tasks: cognitive restructuring, where thought patterns are sought to be changed, and behavioral activation, whereby the client learns to overcome problems so that they are able to participate in activities that bring enjoyment. CBT is also focused on the immediate present, more so focusing on what and how a person is thinking rather than why. Some of the key concepts that are tied to cognitive behavioral therapy include psychoeducation. So due to the limited understanding young people may have in relation to depression, it's important to provide psychoeducation surrounding the process of therapy, the symptoms and causes of depression, and then potentially also involving family members. Understanding and monitoring emotions. So being able to understand emotions and feelings is the first step to being able to manage them. If the adolescent is able to monitor their emotions, they can then start to understand how they respond differently to events, along with the thoughts that may contribute towards these emotions. The therapist may do things like naming emotions, inquiring about the emotions, and helping the young person to develop a vocabulary for emotions, along with rating the intensity of these emotions. Behavioral activation. So behavioral activation is where young people with depression, they tend to lose interest in activities previously found enjoyable. So behavioral activation is where a young person is encouraged to do behaviors that are enjoyable and therefore reinforcing a sense of accomplishment, mastery, and increasing self-esteem. This step will generally involve assessing the young person's current activities and then establishing activities that they previously enjoyed, thus overall generating a list of possible pleasant activities moving forwards. The ABC model is then introduced, and this explains the links between behaviors, feelings, and thoughts, with A meaning activating events, B equals beliefs that are held about the event, and C being consequences that include emotional or behavioral responses. Identifying automatic thoughts is the next stage. And in this stage, young people are taught how to identify and understand how automatic thoughts contribute to how they feel and how they behave. By doing this, the young person will learn to gain greater control over their mood. Depending on the moods identified, targeted therapeutic interventions will then be implemented. In relation to working with unhelpful thinking, so in this stage, the young people are taught how to change and challenge unhelpful thoughts that aid depression. Some of the techniques involved are creating thought records, and by doing this, the young person is able to see how they thought initially in relation to the event, and then how another thought could have resulted in a different behavior. This helps to promote more realistic thinking and reduces negative thinking. Other techniques that are useful for this are challenging thoughts of all or nothing and looking at the positives of keeping a potential thought compared to changing it. Core beliefs are also examined to look at examining and modifying underlying negative core beliefs to more positive ones. Relapse prevention is the final stage where preventative measures are taken to reduce future relapse. So due to the tendency of depression reoccurring, the therapist and young person will discuss certain strategies to prevent it from occurring in the future. This can be done by further psychoeducation surrounding the inevitability of a low mood and reiterating the skills and strengths developed throughout therapy to combat these situations. All in all, depression in young people is something that is extremely prevalent and if left untreated can lead to ongoing issues and impairments. Given the potential risk and issues associated with depression, it's important to have it treated within young people who are experiencing a major depressive issue. Research does indicate that CBT is one of the most effective therapy treatments when it does come to working with young people with depression.